State Representatives Claudia Tenney, Antonio Delgado, John Katko, Tom Reed, and Elise Stefanik introduced the Access to Rural Communities Act last week. The bipartisan bill would help rural hospitals maintain operations after a financially hard year.
Remember, so many of them struggled and suffered during the pandemic last year because they were shut off from services. Many of them had to use their facilities to host and care for COVID positive patients.
Before COVID, rural hospitals were already struggling to make ends meet after the Centers for Medicare and Medicaid Services, or CMS, retroactively changed how hospitals were to be reimbursed for their volume decrease adjustment program, which funds hospitals that experience a significant volume decrease due to circumstances beyond their control. The money is used to pay for staff and services necessary for continued operation of hospitals. But as a result of their new formula, 16 New York State rural hospitals are forced to repay Medicare contractors for payments received years earlier. These rural hospitals owe up to $15 to $20 million.
It's just unfair that they relied on something and now the government's going back and retroactively charging them. And this could bankrupt and force us to lose care in rural settings. And that would be a disaster for our communities.
Hospitals like A.O. Fox in Oneonta are struggling to keep their doors open, but they are vital sources of health care in their small communities.
They're providing services in needy communities and rural areas where they really don't have access to very many patients, but also the patients are needing acute care where they can't get to maybe a city or a larger region.
Reporting from Utica, I'm Karina Gary, Eyewitness News.